I'm Sarah Jones with New York Magazine, and this is What Is Even Happening, a new video series where New York's writers and editors ask experts to help us untangle questions in the news. This week, we're looking at reopening public schools. Why is it so complicated, and is it really safe to open up classrooms? With me is our guest, Dr. Donna Hallas, who is the director of the Pediatric Nurse Practitioner Program at New York University and a clinical professor. So Dr. Hallas, as we're thinking about the prospect of reopening school buildings, what are the risks and challenges that we should be keeping in mind?
So it is a very complicated issue, especially for someplace like New York City, which serves so many children in so many boroughs. And, it is very, very complicated. And I think everybody's been working very hard to get the job done. And yeah, delays are expected as things emerge. So one of the things that I've always supported is testing, knowing, having a testing plan in place. And testing is different from screening. So I do believe they have a screening plan in place where the parents would look at the child in the morning, make sure they don't have a fever, make sure that, they don't have cough, they've not been exposed to anybody who's been tested positive for COVID. So there's all those types of factors. Then, I don't know that they have a specific testing plan in place. I saw that they were testing the teachers. But there is a risk group like the high school students and middle school students who probably should be tested. And now there's a lot of point of care testing, so it's quick, it's simple, you can get the results quickly. And this can identify those who may be very asymptomatic, which everybody's been talking about, and then not permit them to come in person those days. And so there is that hybrid model where some students will be working from home. So if they've tested positive, they need to work from home and be able to, log into the classroom, do all of those types of activities.
Are you aware of another major city or area that's doing it right at the moment that maybe New York City could look at as a model?
So, different cities are doing it differently based upon their numbers. Some schools have gone back and have had to pull back quickly. I believe they don't have a testing plan in place. And that's what's critical because they get a lot of students who quickly transmit, spread the disease. I think right here in New York State, some of the colleges that went back upstate immediately had to shut down because they had so many students test positive. So we need to, I think New York City and, New York State has done a terrific job and is really the lead in the country, I believe. But it's not going to happen overnight because it's just such a big system. I know that they're looking at the buildings, and that was some delay because some buildings are older, some buildings are new. How do you get the ventilation proper? All of those types of things just take lots of times.
Yeah, I'm glad you brought up the buildings. As I'm sure you know, this debate is getting kind of contentious in New York City. Neither parents or people who work in schools seem particularly happy with the mayor right now for different reasons. Our school workers in particular have brought up the issue of these older buildings and ventilation systems that just maybe aren't up to the challenge of COVID. Do you think those school workers are right to worry?
So I think they need to have the engineers, which I believe engineers have come in to look, from what I've read in the newspaper, to look at the different buildings to determine what filters need to be in place and how many filters need to be cleaned and how often they need to be cleaned based on their system. So there are like the HEPA filters, they're very expensive. They're the ones that we use in the hospital settings and, other offices. So, there is that aerosol. That's what the concern is. So the correct filters that can remove that from the air is what's needed. So obviously I'm not an engineer, but I think that we need to count on the engineers and to then listen, which buildings really need to be stepped up. And, this probably is a time to, think again about the Defense Production Act, because we do need these things in the school system. We have a great educational system. So if we need to do other things this time of, year and in this pandemic, it needs to just be done. The funds are probably an issue with state funds and federal funds and how you get them all.
Right. Do you think that there is a way from a public health perspective to sort of bridge the needs of parents, who need childcare and need to send their children back to school, and school workers who are afraid that, there is a risk of infection if they go back to the actual physical building?
So the school personnel, the teachers, and everybody who makes school happen, bus drivers, custodians, all, the admins who work in the buildings, they all need to be educated on how to protect themselves. And I'm assuming that's been done. So, people like just basic simple things. You wash your hands, we all know this, before you put your mask on, but do people also know you wash your hands before you take your mask off? Because if your hands were dirty and now you're touching your face, you're getting, you're recontaminating yourself. So there's like basic principles. So should they wear a face shield? Yes. A recent study came out that glasses help protect. I'm a proponent of wearing like goggle type glasses, that because if you're rubbing your eyes, if you have something that's shielding your eyes, you're not going to do that. And then it is the distance. So they do have to be assured that whether there's plexiglass around the teacher, if the teacher's in the classroom where she can see the students or he can see the students, and the students are separated, properly from each other, and parents are doing their role. I know they want to, if they're working, it's difficult. I had young children too, but you can't send the child to school sick. You have to, take responsibility. So this is a community responsibility, a community effort. And, that's where we all have to think, what's public health is for everybody there.
Right. All right. One last question. And that's sort of, how did we get to this point, obviously? Were there lessons that maybe the city and the Department of Education in particular could have learned from the spring, or are there longstanding health disparities and infrastructure issues that maybe could have foreshadowed the difficulties in running schools in the middle of a pandemic?
So, I don't think you could blame anybody. We were confronted in March, like probably the end of February, beginning of March, with massive disease. And you have to focus on that. People were dying quickly. It was unbelievable. Nurses, medical professionals, EMTs were confronting a disease we had no treatment for, we still don't, but not knowing what to do at all, is really critical. So you have to look at each step. So they closed the schools, and I'm sure they started thinking about it as we started thinking about reopening schools in like April. We said, let's investigate what can we do as nurse practitioners, as nurses, to open schools and keep everybody safe. So that took a lot of talk just among some nurse practitioners and nurses that I worked with. But then we looked at K through 12. So I don't think you could say, it's at fault. I'm sure they've been looking at it, but it takes time to do all of those buildings, to look at all of the children, and then to think about which children are really at highest risk that maybe can't come back to the school system and be safe. And, parents have to talk to their healthcare providers, whether it's the physician, the nurse practitioner, the school nurse. Can my child be in school safely? Those are individual type decisions. So I think it takes time, and it's correct to say, okay, we plan to open whatever, September 7th or 9th, but we had to stop because other things emerge. It'll happen, but it has to happen safely. And I'm getting the idea that New York City and New York State, it really has safety on the forefront, the masks. So where other states that we see had huge surges don't have the types of rules or regulations or policies in place. So it's taking time. That's what's going to happen. And we do have the capability for online learning while that's happening.